The state of pediatric heart care right now is good. For years we were concentrating on surviving, and many of these heart defects and heart problems that children face right now were considered fatal or didn't really have a treatment, even if they weren't immediately fatal.
In the past, we've made significant strides in treating patients with complex single ventricle defects and having them survive into childhood and into adulthood. But now we realize that they have the potential of developing heart failure later in life. And so that's going to be the next challenge for us as a field to deal with.
For a long time, care was focused on just getting through treating that heart disease. And now that survival by itself is not what we're striving for, because that's actually sort of expected, our attention has turned a lot to care after surgery or care after treatment of the initial disease, and what sort of things happen to these patients long term.
So the paradigm that I see, or I hope to develop, is that we have a patient who is born with a single ventricle defect, and we obtain stem cells from these patients early on and then utilize them later in life before they start developing heart failure, so as to keep that single ventricle healthy and pumping strong.
A lot of my own research here focuses on single ventricle patients, specifically patients who have gone through to have Fontan, which is kind of the third and final stage of repair of a single ventricle type of congenital heart disease. These patients used to be focused on just getting them to Fontan, and we considered it a great success when they reached Fontan. What we're finding is there are many complications that these patients can develop late. We need to be really focused on why they're developing problems with other organs years after their seemingly completely successful Fontan surgery. I hope the future for kids with congenital heart disease is that we can anticipate these complications that happen to them after surgery well in advance of them happening. So my hope is that we will continue to stay out in front of as many of these things that happen as we can, to the point where we have treatments for everything.